Bed sores, or also called pressure sores, that is mostly at the buttocks, at the heels, or at the elbows. And that is something which bedridden people have if they have lying for a long time on that part of the skin of the body. These are then cracks and weeps in the skin. That is according to Keith Hodgkin's Family Medical Advisor book on the page 89, but this is no medical advice. If you click this video away, then please tell me what the reason for it was so that I can improve. Otherwise, hi and welcome. I'm trying to learn medicine. Today, bed sores and benign tumor and varicoses. And after we've done that, we're gonna do stretching. And if you participate in the stretching, then it's at your own risk. And we're talking about internal anatomy and disease things and also a bit about wounds and so on. And this is no medical advice. I'm just trying to read and to understand it. Bed sores. Painful places where the skin cracks and weeps, caused by irritation and continuous pressure on the body. Also known as pressure sores. Bed sores usually occur on the buttocks, heels and elbows of a bedridden patient or patients. Okay, bed sores, these are cracks and weeps. These are in the skin cracks and weeps because a patient or a person has lying for a long time on that part of the body. It occurs mostly at the buttocks, heels and elbows. Heels. Buttocks, heels and elbows. Bedridden. I don't know what the word means. I think it means people who lie long because they can't walk anymore. Bed sores, also called pressure sores. That is mostly at the elbows, heels or buttocks, and it is by bedridden people who had for a long time pressure on that part of the body. I'm going to start the second camera directly next to the bed and try to save it. Bed sores, or also called pressure sores, that is mostly at the buttocks, at the heels or at the elbows. And that is something which bedridden people have if they have lying for a long time on that part of the skin of the body. These are then cracks and weeps in the skin. That is according to Keith Hodgkin's Family Medical Advisor book on the page 89, but this is no medical advice. Okay. And we have the second part here. I think it's pronounced benign, but I read it more like benign. Benign tumor. Benign tumor. A non-cancerous growth of tissue, that is, one that does not invade surrounding tissue and spread to other parts of the body. Examples of benign tumors are fibroids in the womb and papillomas in the nose. Let's go for one moment to fibroids. Now we're going to talk a bit about internal anatomy. Benign tumor of the muscle wall of the uterus. 1/3 of women over the age of 35 will have one or more fibroids. They do not necessarily cause any symptoms and never become cancerous. So the muscle wall of the uterus. So we're going to talk now a bit about menstruation and internal genitals also a little bit. So heavy periods, the symptoms, heavy periods at the age of 30 to 50, painful periods, backache. In some cases, there's swelling in the lower abdomen. Persist once they have developed and may slowly grow larger unless removed. Complications, anemia may be developed and rarely degeneration of the muscle wall. If periods become heavier than usual and painful, consult the doctor. If there's swelling. And then outlook. Excellent with treatment. If there is, what is the treatment? Carry out an internal pelvic examination. Give a blood test for anemia. That is what the doctor does. Arrange for an examination by a gynecologist. If there is infertility or annoying symptoms present, the fibroids may be. So if there is infertility or annoying symptoms present, the fibroids may be removed under general anesthetic. If a patient is past childbearing age and there are many fibroids, a hysterectomy may be performed. So the fibroids are removed, and the fibroids, that is the tumor of the muscle walls of the uterus. It is not the muscle wall of the uterus itself. Okay, fibroids. That is such a non-benign, so not cancerous growth of the walls of the uterus, but this is no medical advice. I just read it and I try to understand it. Okay, so next thing. Keep going. Papillomas. Papilloma. A usually benign, so non-cancerous tumor that develops either on the skin or on the mucous membrane, the moist tissue that lines most of the cavities and passages in the body. Any wart that becomes painful, changes in appearance, or emits a discharge should be reported to a doctor. Papilloma of the bladder may cause recurrent painless attacks of blood in the urine. Although not cancerous, it can be difficult to eradicate and may cause anemia. So anemia is not enough hemoglobin, not enough oxygen carrying hemoglobin in the body, something like that. So it is a benign tumor that develops either on the skin or on the mucous membrane, which is the moist tissue that lines most of the cavities and passages in the body. I think I know mostly what I mean, what I'm talking about. Okay, benign tumor. And examples of such a benign tumor are the fibroids in the womb and papillomas in the nose. So some type of something, but it was just I can't remember what it was in the muscle, something at the lining of cavities of the nose or something, which had something, I don't know, was it inflamed, infected, I don't know, it was, I think inflamed, whatever. And here the fibroids, that was the non-benign growth of muscle wall, was it a muscle wall of the uterus. So, benign tumor, that is a non-cancerous growth of tissue. So the tissue is growing, but so it is a growing of tissue, but that growing of tissue is not invading the surrounding tissue, and it is also not spreading to other parts of the body. Let's take the thing with fibroids as an example. It's the most easiest thing to understand. Fibroids, uterine fibrositis. That's something else. Inflammation of the fibrous connective tissue of muscles. Fibroma, a benign that is non-cancerous tumor which is sometimes found in fibrous tissue, particularly in tissue surrounding the nerves, and I don't know if I can talk about that. And fibroedema of the breast, that is also a soft, sometimes intermittent lump in the breast that is usually non-cancerous. The lump is also known as a breast mouse since it slips away from fingers when the breast is being examined. Okay, fibroid uterine. It's a benign tumor of the muscle wall of the uterus. So the muscle wall of the uterus has it basically. No, it's not really written what it is. And so what is happening? Is the muscle wall growing or something? Benign tumor of the muscle wall of the uterus. If there is infertility or annoying symptoms present, the fibroids may be removed under general anesthetic. We don't have time left, and I can't really concentrate right now what we're going to do. So we're not going to do the part to the borreliosis, and also not the video to the benign tumor. Maybe we're going to not, I can't decide if you use the example for fibroids or not, or if you not use anyone at all. That means that was the medical part. We're going to come back in the next part of medicine to the benign tumor, and then also to the borreliosis. If you were here for medicine, then that was no medical advice. You can go directly to the next part of medicine, where we're going to do the benign tumor and the borreliosis. If you stay here and participate in the stretching, then it's better the arms. Have your feet standing together, and we're starting with a rooting tree. Toes to the outside, toes, heels, heels, toes, toes, heels, heels. And again in, but this time stay down with the body. So go into the knees. And up into the middle. And then come up again. Legs split wide apart, and breathe in and lift the arms up. And breathe out and go to the side. Again in. And out over to the other side. Again in. And out, down, one hand slides down the leg and the other shoulder stays down. Breathe again in. And out one arm over. Breathe in and over the rib cage. And breathe out back into the middle. Breathe again in. And out one hand slides down the leg. Shoulder stays down. Breathe again in. And out one arm over. Breathe in and over the rib cage. And out into the middle. Now have the feet standing together. Breathe in the arms up. And breathe out one hand down and reach. Again in. Out the other hand down and reach. Again in and up. Breathe out and reach high. And now breathe in and reach. And out. Again in. And out. And hands down. Legs shoulder width wide apart, and we're doing shoulder circles. Back with the shoulders up and front and down. And back, up and front and down. And backwards and front. Back and down again. Now breathe in and lift the shoulders up. And breathe out, lift them forward down. Again in. And out. Breathe in and lift the arms up. And reach always with one hand high up. Pretend to take an apple hanging high on an apple branch, to turn it a bit around and then to plug it out. And the next exercise, legs wide apart, arms up to the letter T, and breathe in. And breathe out and shift just with the upper part of the body over to one side. Again in, out to the other side, in, and out as we're leaning onto the knees. Breathe again in. And out one shoulder in front. In and back. Out the other one in front. In and back. Out one in front. In and back. Out one in front. In and back. And out and we're hanging down. Breathe again in. And out go over to one leg. Breathe again in. Out over to the other leg. Breathe again in. Out into the middle. And also feet. But keep on hanging down and breathe again in. And out. Again in. And out comes slowly with the round back up. And make it to top of back with the shoulder. And wait. Not completely. The toes pointed to the outside, having an ulnar length space between the heels. Breathe in and lift the arms up. And breathe out and sink down. The elbows against the inside of the knees. Breathe in and straighten up. And breathe out and come with the back up. Breathe again in. out and down. Breathe in and straighten up. And out and come slowly in one straight line upwards. Hands again down. Legs wide apart, breathing down. And breathe out. In and up. Then breathe already at the top out. In and up. Out and down. Breathe in and close the legs. And breathe again out. That was the stretching. I thank you very much and next time.